What is it like being a parent and a doctor at the same time?
Honestly, I feel like we are parents just like anyone else. At home, we are parents before doctors. So we do what all parents do: prepare meals, clean, help with homework, dress our kids, drive our kids around. Very, very much the same. And it's really interesting because our kids don't see us as doctors. They see us as mommy or daddy. So being a doctor is mommy or daddy's job. I grew up in a home with working parents, and my parents worked an 8 to 5 job every day. So I pretty much see myself very much like them. A benefit, though, of being a doctor and a parent, there's not too many doctor visits if your kids are overall without any chronic medical conditions, because you can essentially manage those yourself at home.
Yeah, definitely. You don't get as scared. Like if there's a fever or there's ear pain, you got that. You don't want to necessarily manage the complicated things, but definitely the simple things. It saves you a lot of time. Are you able to do the normal parent activities that parents who are not doctors would do?
I would say for the most part, yes, we do all the normal parent activities, but the challenging part is if the parent activity is unplanned or comes up with minimal notice. So, to what extent you can be involved really depends on your specialty, your spouse's type of work, where you work, whether it's a clinic, a hospital, you're doing research, academics, or working for a pharmaceutical company, and then your work schedule. So, the different work schedules that most doctors tend to have is either you work like a day shift, which usually involves anywhere from 8 to 12 hours a day, a night shift, so that's working overnight 8 to 12 hours, or there's also another type of position that hospitalists work, and it's a 7 on and 7 off. A type of schedule that they may have is where they work 12-hour shifts for 7 days straight, but then they have 7 days straight off. So that kind of opens up a little bit more flexibility to do more things.
Who takes care of your children?
For many doctors, their kids are cared for by a nanny, a family member, or daycare. Some doctors actually hire live-in nannies, so they'll help care for their children, and they also help with things around the house. Most doctors will also have backup babysitters, just in case your nanny or your babysitter calls out sick, you have someone else's as well. I personally had my kids in a daycare center from infancy until 5, so until they age to start a kindergarten. And this was just the right choice for my family. This is what worked well for us. And then I had the benefit too that I had my extended family around. So in case if there was an emergency because they were sick, they couldn't go to the daycare, then that's where my family would step in as well. So again, childcare will ultimately depend on your social support and you and your partner's job. Dr. Marina, what type of advice do you give them when they ask you about the timing of being a parent?
I pretty much tell them exactly what you're saying, that there's no perfect time, there's no perfect way to be a parent. Medical school and residency and a full-time career is pretty demanding compared to other jobs. The work hour requirements can be higher, so it is a little bit trickier. The timing is going to be dependent on your situation, your family, your support systems, your finances, your personal health even. You know, some women get concerned that the older you get, the lower your fertility is. So especially if you're trying to conceive a child after around age 35, it becomes harder to conceive. So then, yes, it's probably more important to consider having children earlier, whether that's in medical school or residency or early in your career. If you make that a priority and you have the resources, then you can do it. What are the most difficult challenges of being both a parent and a doctor?
As a physician, you're supposed to always put your patient's best interest first. And then as a parent, you're supposed to always put your children first. And then as a spouse, you're supposed to always put your spouse first. So imagine when a situation comes up and all of these just come crashing with each other. So your child is sick and then the school tells you to come pick them up. You got like 15 or 20 minutes to pick them up. You're in clinic. You have more than 20 patients scheduled. Some of them are already in the exam room, half naked. Some are in the waiting room. And if you stay, you go through this process, you're like, who's going to pick up my child? You go into parent gear and your mind is like, my poor baby, is my baby okay? So while this is challenging for a doctor, the reality is that you just figure it out. It's your child. I personally feel that you shouldn't have to compromise your own children because they are top priority. We feed ourselves that guilt guilty feeling where our kids aren't even there. I remember how bad I would feel when like my child was the last one to be picked up from daycare. I'm like,
Uh-huh.
oh my God, I'm the most terrible mom. And again, we feed ourselves, oh, they're gonna, resent us, this and that. But when I go and I sometimes will do little talks about being a doctor with their classes, the look in their eyes, they're so proud of mommy. And when you see that, you're
Aw.
like, oh my God, all this time, here I am feeling guilty. But yet in their eyes, they're really proud of what you do. So a lot of
Uh-huh.
it sometimes is us feeding it into our own mind. And then I think too, doctors also have vacation time. My kids have been able to do so many things that I only dreamed of as a child. And, if it weren't for me being a doctor, I don't know if I would have been able to give them that opportunity. I just want all of you to know that it's totally possible to be a doctor and a parent. Most physicians, men and women, have children. You will find that being a physician, your relationship with your child will be based on the quality and not necessarily on the quantity of the time that you spend with your child. You also realize that you are in control of your life and schedule. So you look for work environments that support that. Also, as your kids are growing, you will realize that the work-life balance is a dynamic process and your work life will shift and readjust over and over again. And just like the medical journey requires a supportive environment to thrive, so does being a parent. It really does take a village to raise a child, regardless of what career path you are in. And lastly, I personally feel like I became a better doctor after I became a parent.